Hi, my name is Leo, and I'm a physiotherapist practicing in Canada. A few weeks ago, I ruptured my Achilles, and I've seen a lot of YouTube videos of people documenting their rehab journey, and I want to contribute my part in telling you about my rehab program and give you tips and advice from a physiotherapist point of view because I'll be doing my own rehab, and I thought I could try to help someone out there who is going through the same injury as myself. So to tell you a little bit about how I injured myself, I was at an obstacle course where you have to run up a warped wall and try to grab the top of it. And as I was taking my first step on my sprint towards the wall, I felt a large pop in my calf and I fell immediately to the ground. And if you ever ask someone who ruptured their Achilles, they'll all say that they thought that somebody kicked them in the calf. And that would be exactly how I felt as well. Unfortunately, no one naturally kicked me, and when I felt my tendon, it wasn't there, and there was a divot in the tendon, and I knew immediately that I had ruptured it. I was hoping initially that it was just a partial rupture, but when you do a test called Thompson test, where you squeeze a calf to see if the foot moves, it didn't, so that was a positive sign for a complete rupture. And the doctor in the emergency department at the hospital also did the same test and confirmed that it was probably complete. So the night of the incident, I was sent home in a plaster cast with my toes pointed down to try to approximate the two torn ends of the tendon. So as you probably already know, there's some debate about whether having surgery or no surgery is better to heal an Achilles rupture. And here's how I decided to go with surgery in my case. I actually had two orthopedic consults with two different surgeons. The first one, which I saw a few days after my injury, did not recommend surgery because she said that based on the research and her experience, the people who don't have surgery, they recover the same way as people who do, and she didn't really find any benefit in doing surgery on me. She said that there was no difference in rupture rates, and in terms of athletic performance, she hasn't found any difference either. And for me, that was a little bit hard to believe because I've seen people in the clinic with both surgery and no surgery. And I tend to find that the people who don't have surgery have some problems with pushing off the foot, and they don't really get back to what they were doing before. And if you compare the injured side and the unaffected side, you can see quite a difference in the amount of the strength in the feet. So I opted to have a second opinion just a few days after my first one, and this surgeon actually recommended surgery because he did an ultrasound to see how much of a separation there was between the two ends of the tendon, and he found that there was a 3 centimeter gap. And he said that when the two ends of the tendon heal and fill with scar tissue, it will be elongated, and as a result, you wouldn't be able to produce as much power. And for me, that was really important because I want to go back to playing tennis, and that was an important factor for me to decide to do surgery. But the surgery itself went well. I was giving an epidural and also a nerve block to the sciatic nerve, which is a nerve running down the back of your leg, and also a local anesthetic to the incision site. And right now I feel pretty good. I'm not taking any more pain medication. I was given a prescription for Percocets, which I haven't had to fill. The first couple of days when the nerve block was still in effect, I did not feel any pain whatsoever, although my toes were still pretty numb. And after the third day, the pain started to get really, really intense, and I had no choice but to take some Tylenol, which has been sufficient in my case to help control pain. The rehab protocol between surgery and non-surgical is about the same. And so for the first 2 weeks, I'll be in a cast and not weight bearing at all. And from week 2 to 6, I'll have my cast off and be put in an air cast boot with a heel wedge to keep the foot slightly pointed down. And I can put partial weight with crutches. And then from week 6 onwards, I'll be weight bearing as tolerated, meaning I can put full weight down. I don't have to walk around with crutches anymore. And from then on, it's just keeping on and building your strength back, increasing your range of motion, and eventually going back to sports training, doing more explosive movements and jumping, so that you can return to sports safely. All right, so I have some tips and advice for you. It's going to be a tough couple of weeks because you'll be in a cast and fully non-weight bearing. And as you can imagine, it can make walking and doing stairs really difficult. The first piece of advice I have for you is I recommend getting a knee crutch, which looks like this. This is called the iWalk 2.0, and how it works is to put your knee up on the pad here. It allows you to walk without using crutches, which frees up your hands, and I found that to be a huge benefit when you can't weight bear on your injured leg. My second piece of advice is to get a muscle and nerve stimulation device. And these devices are great for promoting circulation and reducing swelling. And I use a device every night when I go to sleep. I would lie down on my back, put my legs up on a pillow to elevate my foot, and then I would apply the device to my quad muscles. And when I turn the machine on, it will make the quads contract, so it creates a muscle pumping action, which helps to promote circulation. And I'll leave it on for about an hour while I fall asleep. And so far, it's been working great. When I first wake up in the morning, I feel some sore pain in my Achilles when I put my foot down, but after a few minutes, then I'm good to go. I don't feel any pain for the rest of the day. My third and last piece of advice for today is quite simple, but also very important, which is to stay as active as you can and go about your daily routines as much as possible. As you can imagine, the first few weeks are going to be very tough when you can't weight bear and it's tough to get around. But some people, it's really easy to get depressed when you're stuck at home and not mobile. So if you can do your work in any capacity, do it and try to stay engaged, maybe learn a new skill, read a book, do something that you normally don't do. And it will really help you get through the first few weeks. So there you go. Those are my tips and advice for now. I'll be making more videos in the future to talk about my progress and my rehab program. In the meantime, if you have any questions or comments, feel free to post them below and I'll try to respond to you as soon as I can. I hope you found the information today useful. And until next time, thanks for watching. Bye for now.